Thank you, Maureen. I'll first say that my name is Eric Mukoya. I am a lawyer by training, but not a practitioner, so I don't go to court. Nonetheless, I understand law a bit to the extent that I can share with the rest of the world what does it mean when it comes to COVID-19, looking at Kenya, but as an example of the African region in terms of response. So number one is that COVID-19 has found us. It is something new. It's not something that anybody is an expert. And therefore, all of us are trying to navigate the space with the little information that scientists are sharing with us. In that context, many governments have done three major things. One, they have implored us to stay at home. Number two, they have asked us to social distance. Number three, they have requested us to put on masks. And those three things are important when it comes to containing infections in a scenario. Nonetheless, considering that sometimes people have to survive, people must go out because we have people who live hand to mouth. And that means that unless they go out, they'll have no food. Considering all the scenarios, the government has gone forward and decided that we will have isolation centers, we will have quarantine centers for people they think have flouted the law. So a number of things then emerge. Number one, in terms of quarantine, one weapon that most governments have used is either a curfew or a lockdown. The lockdown could be partial, the lockdown could be total. Where it is partial, then we have curfews like the one in Kenya. What that means that all of us must be at home at 7 p.m. But also that means that public transport must only operate up to a particular time. What has happened, therefore, is that now people are being arrested and being taken to quarantine by force. Not for their own fault, for the fault that they're looking for food for their children. And therefore, as we quarantine people, forcefully or otherwise, do we look at the bigger picture of how then do vulnerable communities, vulnerable societies, the women, the children, and the only breadwinners that we have, what does that mean when it comes to food security, when it comes to health security? Number two of that is those arbitrary arrests that have been done by police, and Kenya is a good example, have become avenues for corruption. We have police officers now who will arrest you, not because they want to quarantine you, but they want to use that particular threat so that you bribe them. And that in itself is hurting many people. But in that context of quarantine, and in the context of being arrested and being taken to that particular center, the question we are asking is this: is quarantine a police cell? Is quarantine a prison?
Yeah, the quarantine people are asking the same question.
Because the point is
escaping over the walls.
Exactly. And so what we are saying is there's something we call due process. While COVID-19 came, it did not suspend the use of law. COVID-19 did not suspend the rule of law. And therefore, if quarantine is to be synonymous to a police cell or synonymous to a prison for you to be there for 14 days, then there's due process that the government requires to take someone to court. The court needs to listen to that person. We have online facilities that we can use for someone to say, yes, I was out at 7, but I have a mitigation. My mitigation is I was coming from work. And therefore, there is no way I'd have wanted to stay home out of my house at 7. I have children, I have a wife, I have a husband, I have a mother who is sick at home. That is something very fundamental. Number 3 of that is right now, because of quarantine, right now, because of stay-home orders, there is increased gender-based violence. There's increased violence on children. There's increased violence sexually.
Yes.
The only bad part is that...
this is a global issue, you know. This is also global.
Yes, it is very global.
Yeah. Like in the UK, I heard that the government has actually allocated quite a bit of money. And I think Theresa May, the ex-prime minister, made an appeal to the government, you know, to create some funds and to consider the social aspects, especially the stay-at-home issues of people who are staying with their abusers.
Exactly. And now, thanks for that. And now that women are suffering and other vulnerable genders are suffering, the question we are asking is this: as a country and as a region, how prepared are we? Particularly when you have countries that have no safe houses for women, have no safe houses for children. And the worst part of it is that because the prisons can't take any more prisoners, because the police can't hold many people in the cells because of fear of infections, most of those cases are diverted by either referring those matters to alternative dispute resolution in the villages or giving cheaper bail terms. When you release this person as a perpetrator, they go back to the same house where that woman is staying, where that child is staying. And therefore, we expose the vulnerable groups to double jeopardy, that they'll be violated and violated again because of the stay-home orders. So that is a sign of concern that we need to address.
Yeah, quick question, Eric. Were the legal services identified as an essential service?
Yes, thanks for bringing that point. I was going to talk about it. While legal services are an essential service, you need to understand that the court is not sitting. And if the court is not sitting, yes, so that means there is no adjudicator. We don't have a normal litigation process because the court has taken leave. Why has it taken leave? Because of fearing infections, because courts generally have people. And number two of that, the Kenyan courts are still averse to technology, to the extent that even where technology will have worked, their email sometimes doesn't work. So if a simple email doesn't work, you'd want to imagine when you're holding a Zoom meeting. Nonetheless, I will speak for Legal Resources Foundation. We have been able to link some 2 or 3 prisons facilities in Nairobi to Makadara law courts and Milimani law courts. Particularly, the courts have the facility, but prisons don't have the facility. So we've been able to provide laptops and airtime in terms of bundles just to facilitate some plea mentions and some mentions and plea taking, so that then people who are not supposed to be in remand homes can be released when their bonds and bail terms have been reviewed. Having said that, the other aspect that is quite important and we need to be alluded to, especially legal services, is we have emergency legislation. Emergency legislation where legislation is being created to facilitate the quarantine, to facilitate the curfew, to facilitate the stay-home orders. And some of these emergency legislations are going against the Constitution because we realize that we are ready for a movement to be curtailed, but we are not ready for our rights to find food to be curtailed. And therefore, what the government needed to have done, especially in Kenya, instead of using the Public Health Order Act, they needed to have used the Public Health Act, because the Order Act then will have given us ways in which someone can be taken to a quarantine. You require a medical report. But here in Kenya, you are arrested and taken to a quarantine. So due process is not followed. Something else that I may need to talk to is about families that have sick patients, families that have ailing patients, and the hospitals are less concerned by some of those sicknesses right now. Their focus is in COVID-19.
Yes, that's true.
I'm talking from experience. I have a sickling brother. I have a brother who has cancer. He was released from hospital for the fear that he will contract COVID-19. While the concern is genuine and valid, I don't find the logic that he has to leave the hospital and have to employ a clinical officer in my home so that my brother can be taken care of. So while I appreciate that some of those actions are important, I just think the enforcement is wanting. The enforcement is wanting at the level of police. The enforcement is wanting at the level of the ministry, particularly when the CS of health now is the prosecutor, is the judge, he's everything, and he takes you to a quarantine and he doesn't care. And what's more is, it is not my fault to get COVID-19. If I went to America and I came back with COVID-19, it wasn't my fault. I didn't go to collect it. I want to do business. So why would I pay for my medical bills? It's a national issue. It's a global pandemic. And therefore, if the government is saying we are paying, the question is the monies they are generating. And I was in another meeting today where they said, so far, in terms of support, almost support that is going to almost 1 billion has been provided, either in terms of money, technical support, masks, and number of stuff. So the question is, there's no clarity on how this situation is panning out, particularly how it is affecting people's rights. And I would be happy if the world can say, do we have a platform where we can give out the untold stories of COVID-19 that will not see the limelight? People are dying, people are hungry, people don't have food, children are not going to school, children are missing out on education because not all of us have smartphones, not all of us have TVs.
Television sets. Yeah, that's true.
So all these things needed to have been contemplated and contextualized so that the response will have been staggered to respond to every scenario that every Kenyan or every other person around the world is faced with.
Okay. Thank you so much for that really enlightening, very enlightening information, so well put together. Now, I only have one question. What about the rest of Africa or the rest of East Africa?